How does hypnotherapy work when you're treating addicts?
So we have two parts of our brain. We have the conscious and the unconscious. And regardless as to what they would have you believe on the TV, it's not all about watches and making people bark like dogs. It is actually a very serious process that involves those two parts of your brain. When you go into really, really deep relaxation to the level where you're almost asleep, that point just before you fall asleep, when you feel kind of you can't feel your body, but you know that if you heard a noise downstairs, you'd be on your feet straight away. The two parts of your brain start to dissociate a little bit from each other. So you're able then to make suggestion to the unconscious part of your brain, which is the really powerful part of your brain that holds all your emotion or your memory or your learnt behaviour. And you can make suggestion to that part of your brain to help it to change the way that it feels about certain things, certain behaviours.
Does it always work?
It doesn't work for everybody. It's not a magic cure. But it is very successful for lots and lots of people, particularly with addiction.
And do you try the same method of hypnotherapy regardless of the type of addiction?
Absolutely not. So it really depends on the person, and it depends on their addiction. Something like smoking is very much a pattern-led, habit-based addiction with very little emotionally driven behaviour. Something like cocaine or gambling are very much more complicated than that. So there is an awful lot of processing to be done. So it's not just about treating the symptoms, it's about looking at the cause. So it may be going way back to their childhood, to learned behaviours. There may be addiction in their family. There may be challenges throughout their life, trauma, all kinds of things that have led them to use these substances as a way of trying to self-medicate. So it's much more complicated. There's a lot more psychological input involved.
And Nuno, what kind of treatments do you offer at UCAT?
At UCAT, we offer treatments for behavioral addictions and substance addictions. Behavioral being like gambling addiction, sex addiction, eating disorders, and substance addiction being like alcohol addiction, or heroin addiction, or any other substances. Yeah.
And how do you decide, Nuno, how to treat somebody?
The core of the treatment is like the same for everyone. Because like Sarah was saying, we try to understand what triggered the symptom. So the addiction for drug addiction, for example, or gambling addiction is just a symptom. So we try to understand what triggered that person to get addicted. Then we have like sub-programs that will kind of address that particular addiction. Like the gambling, we have like a group or a program or assignments that will help the clients to work on those more specific like addiction, if you know what I mean. But the core is like pretty much the same for everyone.
And Nuno, do you have to sort of examine the patient more than the addiction to determine how he or she is going to be treated?
Yeah, a very comprehensive assessment is crucial. So we need to see where the client is, where from the medical perspective, what kind of support, medical support that person might need, the family, the system around that person, and so on. So the treatment plan is going to be based on that assessment on the client, and that is much more important than the addiction itself.
And Sarah, what is the most common addiction that you've had to treat? And has the number of addictions or type of addictions changed over the years?
Yes, very good question. It always used to be, smoking was the biggest addiction that I would treat as a hypnotherapist for a long time. Now, cocaine has overtaken that by a mile. So as smoking became less and less socially acceptable, so cocaine became more and more so and more accessible and cheaper. And I think that particularly with the recent lockdown, that's had a big impact as well. And I've seen a big uptick in alcohol particularly, and drug abuse as well.
And how would you treat a cocaine addict?
So again, it goes back to the individual. So it really depends on where it's come from, on what they initially were using it for. So it's not always about the buzz of the hit. People tend to be using it as perhaps a way of escape from something, or a way of trying to give themselves more confidence, all kinds of reasons behind it. So it goes back to looking at where that's come from. And
always, both of you, it's the root causes of the addiction, regardless of the type of addiction. Nuno, what addictions are most common for your type of treatments? I mean, Sarah was just talking, it's changed from smoking to cocaine. That's quite a serious change, I would suggest.
The main addiction is to alcohol. So our main admissions is people that's struggling with alcohol addiction. But, you know, when someone comes into treatment, it's very hard just to find that person has only one addiction. A lot of the time they come cross-addicted, so addicted to alcohol and perhaps to cocaine, or cocaine and gambling, and so on. But the majority of the people that come to our treatment centers is with alcohol addiction. Yeah.
And has that changed because of COVID?
No, that didn't change because of COVID. So the substance...
Well, when I say COVID, I mean lockdown.
Yeah. What changed is that people are delaying to seek for help, to get in touch, to be admitted into treatment. People are worried to be infected from COVID-19. And I think it's fair to say that we got, from the beginning at UCAT, we got like a COVID crisis management team that we are able to put some procedures in place to keep staff and clients protected from COVID-19. But I think that was the main change, was people are a little bit more worried in getting the help and being admitted into treatment, worried to be infected.
And Sarah, I mean, Nuno's basically saying there that anxiety is perhaps creating more addicts. Do we know enough about what causes people to become addicts to whatever?
It differs from person to person, really. Anxiety.
But I mean, is there some kind of common link that will turn people into addicts?
Not really. It's a common misconception that people think that they have an addictive personality. There are so many different factors that contribute. Sometimes there can be a genetic tendency, but it's very rare to be just one thing. So it may be a learnt behaviour, mixture of learnt behaviour from childhood, mixing in a certain social group, but also then using it as a way of coping with something else.
And that's all down to personality and personal experiences, as opposed perhaps to something in the brain.
I think so. Yeah. I mean, it's a lot of things: conditioning, circumstance, type of person. But yeah, I don't think it's there when you're born.
You don't. So Nuno, would you agree with that? So it's not in our DNA. It's something we learn to be addicts.
Yeah, it doesn't have to be. Doesn't have to be. I mean, there is so many theories about addiction. What you said, Stephen, about something in the brain, obviously the brain will change with everything that is around us. So currently, for example, we've been living on a lockdown from March, more or less. So we live in a kind of fear and uncertainty almost every day or every week. We never know what's going to happen next. Obviously, our brain is it's normal to be in a flight or fright
mode,
kind of
fight
mode.
or flight.
So,
finally, to both of you, starting with Nuno, can addicts be completely cured, or is there always the danger of a relapse? Starting with you, Nuno.
I think cured can be a very dangerous word. We believe in ongoing recovery. So we believe that people might need some ongoing support, starting being in residential treatment and continuing some follow-up counseling and because we cannot, going back to the roots of the problem, we cannot just start from the beginning, go back to birth and reset. We were born and we were in touch with situations that changed us.
Yeah.
So we cannot ignore that. So
there's always the danger as far as you're concerned. And Sarah, the same with you?
I agree very much with Nuno that it's a very dangerous word, cure. Yes, I've seen huge, success with people overnight that yeah, they've never touched it again. But let's never say never, because you don't know what's around the corner. And so many people who had been free from their addictions for years have relapsed now within lockdown, because it's such a challenging situation, and it's one that you can never prepare for. So I would never say cure.
Sarah Russell, clinical hypnotherapist, and Nuno Albuquerque, head of treatment at UCAT. Thank you both very much for joining us on The Agenda.
Thank you very much for having us.
Thank you.